Greetings, my name is Sarah.
And I'm Kristen.
And we are the proud founders of Canadian Frontline Nurses, a new branch under the umbrella of Global Frontline Nurses. We want to welcome you to our first event, which is this Canadian Press Conference. As the Canadian Frontline Nurses, our mission is to unite Canadian nurses so our voices can be heard, to speak against these draconian measures that are currently in place in efforts to uphold our oath to do no harm. Our vision is to restore our freedoms and rights as Canadian citizens and reinstate the four ethical principles of autonomy, beneficence, non-maleficence, and justice within nursing.
And this is why we're here, united today, standing before you, risking it all. We're here to stand up for the truth. We're the eyes, the ears, and the heartbeat of hospitals. Many of us have lost our jobs and our licenses are being threatened. We're sharing the truth with you, whatever the cost may be. Our voices will not be silenced. In fact, this has only made us louder, stronger, and more united. We were taught in nursing to be critical thinkers, to follow evidence-based best practice, to ask questions, and to advocate for our patients' health. We have come to realize this means only if it follows the narrative. We're not to question anything that goes against it, and if we do, we're reprimanded and silenced. And this is why so many are unable to speak up. As nurses, we have all pledged with Florence Nightingale before God and in the presence of this assembly to pass our lives in purity and practice our profession faithfully, agreeing to never take or administer any harmful drug. By committing to elevate the standard of our profession, we must recognize that we are the first and last defense in our society for decency, integrity, and compassion. We have the first and last opportunity to do the honorable and dignified thing for people. I know we can all be an example to the rest of the world. Nurses and healthcare professionals, it is our time to rise, to stand for a better world, and to take action daily in the practice of our sacred calling. We must follow our promise, devoting ourselves to the welfare of those committed to our care.
We have an exceptionally powerful lineup of speakers for you today. Please listen with an open mind and heart. It's time we start having hard conversations and listening to the people who are being censored. My name is Sarah Shajunian. I've been a nurse since 2004. I've worked in a nursing home for the greater part of my career. I also held the position of chief steward when I was fired for posting about the truth and my beliefs about the lockdowns online. They tried to silence me, but what they didn't realize is that trying to shut me up would only make me louder. I decided to channel my rage and put it to something positive. Therefore, I spoke out at the protests and founded Nurses Against Lockdowns. When you work in a nursing home, it's easy to see that the government doesn't put much value on these seniors. Did you know that each resident in a nursing home here in Ontario gets an allowance of $9 for food a day compared to $15 for prisoners? That's how much they care about our most sick elderly. Nursing homes were hit the hardest, with residents being isolated from their families for over 10 months now. Public health is calling outbreaks front, back, and center, often with no one having any symptoms. That means that every resident must stay in their rooms for a period of up to 14 days. It's devastating. Our elderly are being treated like prisoners in solitary confinement. The lockdowns have been detrimental to their well-being. They are deteriorating at a faster than normal pace. Many are dying of failure to thrive, and others are dying alone of broken hearts. The elderly do not want to stay alive at all costs. They want quality of life and to be close to their families and caregivers. Studies show that the more social and emotional engagement people have, the more resistant they are to viruses. So why on earth are we doing the opposite of what we know to be right? These are crimes against humanity. Nobody has the right to tell us when and where we see our loved ones, ever. As if this is not enough, now we are being told that residents will be in the first to get this unsafe experimental vaccine. Dr. Kelly Moore, the Associate Director of the Immunization Action Coalition, had the audacity to inform us not to be alarmed if one or multiple people die in nursing homes within a day or two of receiving the vaccine. How crazy is that? We shut down the entire world to protect these vulnerable people, and now we're going to inject them with something that might kill them to protect them? It's insane. We have safe treatments for this. There is no need for risking lives unnecessarily. Dr. Sebi once said, quote, "A society that keeps cures a secret so that they can continue to sell medication for huge profit is not a real society, but a huge mental asylum," end quote. I strongly recommend, for those of you who can, please get your parents and grandparents out of these facilities and bring them home. It will make a world of difference to their well-being. Our elderly are not just useless eaters who should be used for profit. They are extremely precious, filled with love, wisdom, and experience. They've been there for us all along. Now they need us. They need for us to speak for them. This must stop now. Another group of major concern is people with mental health issues. This one hits really close to home for me. I'm a survivor and advocate for child sexual abuse. Many of the people I love the most have struggled with mental health, myself included. Due to the fear, financial instability, and isolation that the lockdowns are creating, we are seeing a significant rise in depression, anxiety, post-traumatic stress disorder, and substance abuse. There's been an increase in overdoses and suicide, with CAMH predicting up to 2,114 excess deaths by suicide from unemployment only in Canada by the end of 2021. What about those lives? Don't they matter? Before the lockdown, I was in the best place of my life. I've been completely sober for a few years and lost 60 pounds. I got help from the Gatehouse, a safe place for adult survivors of child sexual abuse. Their programs helped me so much that I became a facilitator there and even started my own organization called Lighting Up Dark Corners to empower survivors. I felt unstoppable until the pandemic hit. I have complex post-traumatic stress disorder, and some of my biggest triggers are control and depression. I've been continuously triggered and hyper alert ever since this all started. It's been exhausting, and without my usual stress relievers like the gym and group therapy, it's been almost impossible to control my anxiety. I could have given in to the rage and drowned it with alcohol since all the liquor stores stayed open, but that would have meant that they would have won. So I fight the urge. But if someone as mentally tough as me was almost broken down by the lockdowns, can you imagine what it did to people that were already in distress? Not only that, but there is also the unspoken increase in domestic violence, child abuse, divorces, poverty, and starvation globally, which will have many negative repercussions on our communities for decades to come. What makes it worse is that these statistics are not being shown and talked about by the mainstream media. They're literally causing for people to die, and more people will continue to die unnecessarily until we decide to take a stand and say no more. If you are one of the brave souls struggling with mental health, please know that we see you, we love you, and we stand with you. They're trying to break us down. Well, I'm here to remind them that some of us survivors have turned warriors. And once that happens, we become unstoppable and we will no longer be silenced. I refuse to stand by an industry which causes so much harm under the guise of health and safety. This is not healthcare. This is the destruction of health. We all need to stand up and stop complying before it's too late. Revolutions are never easy and require sacrifice. But losing our jobs and material things are nothing compared to losing our liberty and freedoms for the upcoming generations. Please do not let fear and hate take over our humanity. Spread love and don't stay silent in the face of oppression. The world needs for you to be awake and stand up for what is right. It starts with you. Together, we can make the whole world a better place. Peace and love. Our next speaker is Dr. Stephen Malthouse.
Hello, I'm a medical doctor from British Columbia, Canada. I've been in practice as a doctor for 42 years, mostly family practice, but I have worked in palliative care, emergency, rural and urban settings. So I feel that my personal experience with medicine is quite broad, and I've been in the business for a long time. What I'd like to talk about is the COVID vaccines that are coming to us here in Canada and are being rolled out very fast. They're not really vaccines because they don't protect you from passing on or getting infection. They're not typical of what we used to see in other vaccines, stimulating your immune system through injecting some portion of a virus or something like that to get your immunity up and ready to fight something which comes to you. This is different. This is more an experimental biologic product. It's not a true vaccine. And the term experimental actually points out that we are in third phase of the study, the trial. We haven't actually got the trial results. And so, in fact, we don't really even know what is in the vaccine. We don't have the list of the ingredients, which is not necessary that they be supplied to us according to the rules until sometime in 2023. So really what we're seeing is an experimental product rolled out on the population of Canada and the world without consent. In other words, without consent, knowing that one is in a trial. Certainly it's not informed consent because we don't even know the ingredients of the product. And finally, the animal studies which were done prior to the rollout of this vaccine were very brief. They were not independent. And according to the Nuremberg Code, of course, you have to have animal studies done before you're able to proceed with human studies. So this seems to break the Nuremberg Code. Now, why should we be concerned about this so-called vaccine? Well, one is we know, at least from the manufacturer's discussion of the vaccine and their statements, it has not been proven or shown to prevent infection. That means it will not prevent you from catching the disease, COVID-19, and will not prevent you from passing on COVID-19. So the advice is that we're going to continue to wear masks and social distance, lockdowns and so on will not be stopped by rolling out this vaccine, even if you were to vaccinate the entire world. So things will not change. It will not stop the so-called pandemic. Because if we do not stop contagion, we will never reach herd immunity. And if we don't reach herd immunity, then the virus will continue to spread in our communities. There's something else that we need to be concerned about. When they did studies on messenger RNA vaccines before in animals, but also they did something very similar in children, if we look at the animal studies alone, we see that they had this peculiar phenomenon with coronaviruses called pathogenic priming. If you know what it's like to get a bee sting, sometimes the first sting is not a problem, but for people that have allergy to bee stings, it's the second one that causes the swelling, shortness of breath, the generalized inflammation, and anaphylaxis, where people are sometimes hospitalized. With pathogenic priming, this characteristic of coronaviruses when they were trying to make vaccines out of them, the first shot or the second caused an antibody rise, which is significant, and most of the researchers, manufacturers are quite thrilled with that. But when they gave the animals exposure to the wild virus, they developed this generalized inflammation, this immune system override, which caused many or most of the animals to die. So after SARS-1, 2003, they made quite a few attempts to create coronavirus vaccines, similar to what we're seeing today. But these caused this pathogenic priming, which killed most of the animals. They did a similar thing in the late 1960s with children with respiratory syncytial virus. They had 35 kids. They gave them the vaccine. They seemed to have good antibody responses. But when these 35 children were exposed to the real virus in the community, 2 of them died and 80% of them were hospitalized. Again, this showed a form of preparing the immune system to overreact when exposed to the real virus. So we have to be very cautious. And in fact, many vaccine advocates recommended that we proceed with extreme caution, not at warp speed, to roll out a coronavirus vaccine for the whole world. So this is very much an experiment. And I would say for you that, you don't want to rush necessarily to be in the front of the line for an experiment like this. There were quite a few categories that were not tested in the trial, including pregnant women, but also the frail elderly were not included in the trials. And so we do not know what the effects will be on these populations. Already we're seeing that people are having anaphylaxis and autoimmune responses to the vaccines. And we have the Pfizer vaccine and we have the Moderna vaccine here in Canada. And already we're seeing people having reactions to this that are immune oriented. Some of them are occurring quite quickly, but we don't know what's going to happen in the long term. The trials themselves really only went for 2 months in humans. And so we really do not have long-term data. Another thing we have no idea about, because we didn't check this out with animal studies, is the fact that with messenger RNA vaccines, which are designed to create and target a protein on the coronavirus spike, known as syncytin-1, we did not check its effect on the syncytin-1, the same protein which is found in the placenta and also in sperm. Now, the problem there, or the issue, is that if we create an allergic reaction, allergic response to a protein in the placenta and in sperm, this could have disastrous effects on the fertility of people that take this vaccine or this shot. It is truly an experimental product. And we may find, and it has been warned by some of the top scientists, that the risks of infertility by taking this shot may be extremely high. Of course, we kind of wonder, do we really need to give a vaccine to younger age groups where the infection survival rate, IFR, was 99.9% and above? And so really, it's not highly recommended. In fact, in young people, it's discouraged, I would say. At least I would certainly discourage it, because the risk of getting the disease is so much less than the risk of taking the vaccine. As a doctor, I'd have to say that I would be going against my Hippocratic oath if I was to recommend or give this shot to anybody. We have not proven it to be safe, and that is the first part of the Hippocratic oath, to do no harm. Until we know more, until we know what's in the vaccine, until we have actual adequate animal studies, until we have a trial group that shows that it's more effective than has been at least touted in the press, this vaccine cannot be given with informed consent to patients. Now, everyone has heard that these vaccines are 95% effective. Well, what that means is they compare the number of people in the vaccine group and the placebo group. And they take those two groups and they've asked them how many of them got symptoms, and they have a list of symptoms which are characteristic of flu, perhaps COVID, and a few other diseases. And then they go to see a doctor and they have a positive PCR test. Now, this PCR test is the swab they take out of your nose. And we know that that test is 97% false positive producing. In other words, 97 out of 100 people who come up with a positive PCR test will actually not have the disease, or will have such small amounts of it that they will be asymptomatic and certainly not contagious. So we know the PCR test is not reliable, and yet we're using it to make a differentiation among the vaccine group and the placebo group in these trials. So that's completely untrustworthy. In addition, there were thousands of people who actually had symptoms of COVID-19, but did not have PCR tests. If you include those people in the calculations, then these vaccines, at least the Pfizer vaccine, did not protect people from symptoms, not from infection, not from hospital admissions, not from ICU admission, and not from deaths, because they weren't measuring those things. But from symptoms alone was about 19%. That's quite a difference from 95% that you've heard in the newspapers. Of course, we don't have all the study material. That won't be given to us for at least a couple of years. And it's not necessarily that the manufacturers hand that over to us. So we have some really things that we need to be especially concerned about. The other one is these companies, the manufacturers of these so-called vaccines, are free from any liability. That means if you have a problem with them, you're going to have to go to a government board or somewhere else to be compensated for that. So if you have a problem, you don't know where you're going to go to get relief for your misery. These are messenger RNA vaccines. It means that they attach themselves. They go into your cell. They essentially hijack the cell's ability to make proteins. You produce a protein spike, a protein that is on the spike of the coronavirus, and that sets up a immune system reaction, which is going to be a chronic one. In other words, your immune system will be turned on constantly. Now, if you have autoimmune tendencies, this will cause a problem for you potentially, because it'll cause a certain amount of inflammation throughout your body. And we know that because of the polyethylene glycol envelope in which this messenger RNA is delivered through the vaccine into your system, that it can travel across into nerves and brain tissue. What the effects of this will be, of course, we have no idea, because the studies were so short, the trials were so short, and the animal trials were also extremely short. So the issue with the messenger RNA vaccine that no one really knows about is, can it attach to your DNA, this is your genetic material, and be passed down from generation to generation? We do not have the evidence for that, for or against whether that can happen. But theoretically, because of the previous experience with RNA from outside being attached onto your genetic code, this is quite a possibility that we should be concerned about. We are at risk there. So what do we really have to say that this vaccine can do? Well, it can't stop transmission. It may have a risk of infertility. Many people don't really even need it, particularly the younger people. And those people that do need it, the over 70-year-olds who have a higher risk of hospitalization and death from COVID, are those people in which it has not been properly trialed, especially in the frail elderly. These are people that are more susceptible to having adverse effects from vaccination. The other thing we don't know, we don't even know how long it lasts. It could be 2 months, which is the length of the trial research. Could be longer, we really don't know. So I can't say myself that I would recommend this vaccine to anybody. I cannot see any reason that we need the vaccine, since we have other treatments for COVID that have been shown to be highly successful. The people in whom we really need the protection, the frail elderly, have not been properly studied. And we do not even have the ingredients that are in the vaccines themselves. Again, I use the term vaccine quite lightly, because these are really not truly vaccines. This is an experimental biologic product. And again, as a doctor, I feel I could not recommend these to my patients.
And up next, we have Dr. Patrick Phillip.
My name is Patrick Phillips. I'm a family and emergency physician in Northern Ontario. I have a bit of a unique experience since COVID didn't hit nearly as hard in Northern Ontario, but I can attest to a lot of the harms as we've gone through many of those same lockdowns. What I can tell you is that during the first lockdown, we as doctors and as the whole health system working with nurses up north, we were pretty scared. We were seeing what was happening in Wuhan, Northern Italy, and New York, and we were getting ready for the plague to come through. And so we hunkered down and we were getting ready, but that big wave never really came. During that time, our emergency rooms were almost empty. People were scared. They were afraid to come into the emergency department. They're afraid to seek care. A lot of our preventative care, like screenings or referrals to specialists or elective surgeries, were all shut down. The healthcare system was transformed from an in-person healthcare system to what's mostly done through telemedicine now. And people weren't receiving the care that they used to receive. And we figured that was mostly worth it, considering the risks that were going on with COVID. But I can tell you that my opinion began to change when I started to see a big wave of major health consequences for the people of the communities that I serve, starting over the summer and then into the fall. What really tipped me over to know that I needed to speak out was seeing this wave of people who had mild symptoms over the summer, but they were too afraid to seek care, and they missed their cancer screenings and came in to me for the first time having metastatic cancer. I even saw one lady who was managed over the last year for what she called back pain. But when her back pain became so severe that she couldn't handle it anymore, she came into the emergency department. And when she was finally physically examined, I felt a large lump. And that lump ended up being metastatic cancer. And I can name like numbers of these cases that really I haven't seen before, and definitely not in these numbers. That told me that there's something really wrong with the amount of fear and the damage that we're doing to our healthcare system with the fear that's going on. Also, the other side of this is that we've learned so much about COVID over the last year. So much research has been done into what the risk factors are on different treatments, and that information is not getting to the frontline doctors. So things like vitamin D, risk factor modification like weight loss, exercise for hypertension. These are all things that are linked to having severe COVID, and public health is not promoting changing these, like exercise, getting sunlight, supplementing with vitamin D that we know can save lives if people do that, as it fixes deficiencies in your immune system. So I found it more and more disturbing as we're going into a second wave, as the cases are taking off, that we're not doing anything to actually help people to prepare, and that the measures that public health is taking is actually doing the opposite. They've created more fear in our communities. They've told people to stay home. They've kept the liquor stores open and the cannabis stores open while closing the gyms that were not linked with significant outbreaks. That is actually doing the opposite and really impairing people's health and their ability to fight off this virus when it does come. When you combine this with the fact that the case fatality rate has plummeted, meaning that people aren't dying from COVID like they were in Wuhan or Italy. This is not nearly as deadly as we thought it was when we first shut everything down. And it's becoming more and more clear that the damage to the physical health of our people is far outweighing any damage that COVID could cause for most people, especially in the general population outside of long-term care. So that's the physical health part of this. And I think what's even more compelling is the mental health tsunami, the tsunami of depression, of isolation, of despair, people going bankrupt and losing hope for the future that I'm seeing every day when I work in the emergency department. This second wave has torn people's lives apart. And if you leave even the adults aside, which is bad enough, I can't tell you how often I'm now seeing suicidal children coming into my emergency department. Children from the age of, I've seen them as young as 8 up to 14, like 14, 18, like actually like kids coming in who've given up on life. They've lost their friends. They've lost their hope for the future. They've lost any play or any normal childhood activities that allow them to be who they are, with the closing of schools and the damage that's done. And this is something, again, that is not being talked about by public health, and it's very concerning to me. Children are at very low risk from COVID. It's extremely rare for there to be any kind of death or even hospitalization from COVID because children's immune systems seem to be able to fight it off very well. But the damage to the health of our children from these lockdowns, from closed schools, and especially children who come from dysfunctional homes, right? There's a lot of children whose parents aren't emotionally available to them. And so they meet a lot of their emotional needs through school and through friends or through other adults. And these stay-at-home orders have taken away those other caring adults and other caring people from their lives. And it often will exacerbate abuse that's happening. And that's what I'm seeing in my emergency department. And I think that's something that needs to change immediately, because there's no benefit to children of cutting them off from the people who love them, since there's no benefit to them for COVID. They're not really going to get sick with this. It's generally just a mild cold for children. So seeing all this damage that's coming from the lockdown, it's becoming more and more clear. More and more doctors are speaking out. More and more politicians, their consciences aren't allowing them to stay silent around this. And I think it's now time for us to have a discussion as a society on whether or not the harms of these lockdowns is really worth the benefit. And on top of that, we need to be implementing, for those at risk, using the science of the treatments that are coming out, ivermectin, hydroxychloroquine, and vitamin D and risk factor modification, to be able to help the ones who are at risk while letting everybody else continue to live their lives. Thank you.
My name is Kristen Nagel. I'm a registered nurse as well as a holistic nutritionist. I've worked in the neonatal intensive care unit for the last 12 years, and I've been a nurse for the last 14 years. I have a background in both conventional medicine as well as a more holistic approach. I understand both the science and the emotional, spiritual connection to the body. I have since been silenced and reprimanded for being a nurse advocate. So I've been looking around our current society. I do not see health. I see fear, illness, and disempowered individuals, victims. We have been taught that our bodies are not good enough, that they are weak, to ignore our instincts, and place the responsibility of our bodies and health in the hands of someone else. Too much time has been spent researching illness and disease rather than prevention. Frontline nurses are confirming that the current healthcare model focuses on practices that continue to fuel disease, causing harm that is sometimes even fatal. If another way exists that promotes healing, well-being, and empowered sovereign health, then it is our responsibility to investigate and to implement new practices and to change our focus. We are losing meaningful connections and dehumanizing each other. I've witnessed this happen in the NICU as strict restrictions were put in place. Mothers admitted to the antenatal unit were told they could only have one support person. They were sometimes there for weeks, if not months. This meant going without seeing family, including their own children, and sometimes their own partners. During an already stressful experience with a high-risk pregnancy, we are worsening the burden on mom and baby, as well as increasing loneliness and fear. Mothers are now being told to wear a mask during labor. Fathers are also not welcomed in the OR for the birth of their baby during a C-section. If a mother has to be put under general anesthetic for emergency C-section, both parents miss the birth of their child. Having a baby admitted to the NICU is a terrifying experience for parents. We are now denying them support at the bedside, as only one parent is allowed within 24 hours. Our micro preemies can be in the unit for up to 100 days. This is in a time of immense grief, stress, and worry, and now parents are going through this alone. Separating families and their support is completely unethical and has grave long-term effects on the parents, but also the health and resiliency of their baby. What message are we sending to our children when we deny them to be with their parents for months on end as they are away caring for their sibling in the NICU? Our children are now being raised in fear of each other, fear of the world, fear of illnesses, viruses, and germs, even the air they breathe. They're being taught to fear everything, including themselves, when we tell them they are walking threats carrying possible disease. Prolonged fear is terror, and terror becomes trauma. And this psychological damage that is being done is irreversible. This fear creates weakness and suppresses the immune system. Fear does not prevent you from dying. It just prevents you from living. Fear can also turn into anger and hate. We are seeing this more and more as division amongst us grows. And this is not the world I envisioned for my boys to grow up in. But it seems the future of health is no longer eating whole foods, movement, and allowing kids to be kids and getting dirty. It's masks, gloves, sterile environments, isolation, staying home, no more social gatherings, no more visits with family and friends, and a push for more synthetic drugs. As a nurse and a mother, I cannot stand idly by and watch the devastation this is having on people, our elderly, our children, local businesses, and our communities. People are gravely suffering. We're removing our rights, freedoms, and sovereignty. And when we no longer have autonomy over our own bodies and our children's, we have lost everything, and this should terrify you. So we're here as advocates to bring the truth, to stand up for our communities, for our patients, and for our children around us.
I've worked in hospitals for nearly 2 decades, mostly in critical care. I'm blessed to work with an amazing clinical team and witness the growth of Ontario's hospital infrastructure since I started my career at the peak of Toronto's SARS epidemic. I'm grateful to the Canadian Frontline Nurses for giving me this chance to share my 2 cents. I tell you, the main reason I know I'm in a pandemic now, aside from being forced to wear PPE all the time, is seeing the daily case counts screamed at me on TV in the hospital lounge when I take my break from sometimes a half-empty department. And the ICU remains at about 90%, just like it always has. Here's some points I'd like to make. 1, we want our freedom back. Lockdowns, universal masking, it's not public health. Rather, they are radically anti-freedom political concepts that were foisted upon us in March 2020. By contrast, public health science has long demonstrated the causative correlation between unemployment and deaths of despair. In calling for shutdowns of the global economy, the global public health establishment and governments are directly responsible for countless deaths. 2, doctors and nurses are terrified to speak about what they observe with their own eyes, such as suicidality and death caused by delayed treatment due to public health measures. In hushed tones, many of us are asking, where's the second wave when we barely saw a first? We are saying all this lockdown and masking is total BS, but we fear professional and social ostracism, including threats of investigation from our own professional bodies. This amounts to targeted political persecution and an attack on intellectual diversity within the healthcare professions. It must be stopped. Lockdowns and small business shutdown, it's not public health. 3, patients and the public must never be subject to arbitrary violence. I'm a least restraint advocate. Many needless deaths used to be caused by oversedation and excessive restraint use for patients that were inconvenient. Likewise, lockdowns kill. I'm the one wrapping the corpse and comforting the sobbing mother of young children whose husband died of a heart attack because he chose to stay home and save lives instead of getting his chest pain treated promptly. 4, I don't care if the majority of the population supports lockdown and universal masking. These are the same lemmings that would have marched to Mussolini, hailed Hitler, and saluted Stalin. To hell with the majority. The enemies of freedom and human dignity are not Bill Gates or China. It's the ninnying social media moms. It's the healthcare professionals who force masks on the parched and emaciated faces of neglected nursing home patients. It's the irrational, fear-driven masses who think government can provide safety at all costs. These are the true enemies of freedom, which is why we need to show leadership as healthcare professionals in today's COVID landscape. 5, stop calling healthcare workers heroes. At the end of the day, it's a job. The hero meme makes a mockery of frontline workers, Many of us spent ample time during the pandemic with our feet up, waiting for the so-called tsunami to arrive that never showed up. Meanwhile, we were collecting paychecks as our neighbors lost their livelihoods and our children lost out in their childhood. Of course, there are heroes in healthcare. Of course. But that's the result of actual accomplishments, not because Doug Ford or Justin Trudeau anointed us for their own political ends. It causes me moral distress to have taken pandemic pay while my neighbor loses his restaurant for no damn good reason. 6, I'm passionate about freedom and autonomy. There's ample reason for outrage that has nothing to do with the virus and everything to do with the anti-freedom response to it. Autonomy is a central ethical concern for healthcare professionals. It's time for hospital leadership to stand up and say, like hell, you're going to cancel surgeries and shut down mental health based on bogus modeling predictions that time after time after time have proven to be wrong by many, many orders of magnitude. Who are these people? It's time for doctors and nurses to demand their regulatory bodies protect our evidence-based intellectual autonomy, not the murderous edicts of the clipboard people in government and public health who've never spent the tens of thousands of hours we have actually seeing people die from respiratory illness and viruses in general. It's time for citizens to stand up and say, like hell, you'll shut me inside, take away everything that gives me joy, and make me sick and die with your bogus public health measures. A busy hospital is a sign of a flourishing society. Accidents happen, people get sick and die. This is life. And as healthcare workers, that's why we're here. We can figure it out.
And we have joining us Sandy, an audiologist that works in pediatrics.
Hello, my name is Sandy, and I'm an audiologist working in public health in British Columbia, Canada. I work with children and families in assessing, diagnosing, and rehabilitation of hearing loss. I graduated 28 years ago from the University of Western Ontario in London. My research was on the use of clear speech and facial cues in facilitating communication. Never did I imagine that I would be required to cover my mouth while speaking with children who are hard of hearing, who rely so heavily on seeing my face to communicate. Never did I imagine that the journals I read would include articles assessing the attenuation of speech sounds caused by mandatory face mask use. Never did I imagine that I would be fearful of going to work. I enjoy the work that I do and have continued to work with children and their families throughout this lockdown. The threat of possibly becoming ill has not been stressful. The daily barrage of COVID-19 screening questions, daily reports of provincial positive COVID-19 cases, endless meetings and emails regarding information of infection control procedures that I have always used, the closure of workplace common areas, regular messages asking me to be patient while I wait my turn to receive an unwanted, untested vaccine, and the supply of websites to reach out should I be experiencing stress are stressful. If I received any information other than to be kind and be safe that would be beneficial to my health, I missed it. Let us stop the censorship. Let us open a dialogue so that we can become educated and find a way forward other than fear, lockdowns, mandatory masking, mass vaccination, isolation from our friends and families, and closing of our common areas. Surely we can all come together to recognize that fear is not serving us.
Our next speaker is Dr. Anita.
I am pleased to be joining the growing group of clinicians and researchers who hope to restore ethics to a broken system. I'm here today as a private person, with a background in healthcare and a PhD in a related field. I have nearly 40 years of experience in the field. I have clinical and research experience and publications, including a book. I was a university lecturer and a presenter at professional conferences for many years. I also have multiple certifications and registrations that I won't present openly today. In fact, I'm not even using my real name. During all of these years of practice, and as well in academia, I have never come across a situation where professionals are told to follow blindly without questioning, and to hide aspects of their professional selves when stating views that veer from the salient narrative. This new concept violates crucial academic and professional discourse, function, and growth. Diverse viewpoints, new discoveries, academic arguments, and of course respect have contributed to all of the advances in healthcare over the past century. Positive changes have taken place due to our ability to speak up freely about concerns and to instate novel ideas. I am proud to say that throughout my career, I have been an advocate for people and have contributed to changes that benefited individuals, the healthcare system, and society. I could never have completed these tasks if I had been forced to remain silent or feared for my well-being, as now seems to be the case. The fact that one is unable to speak openly and must hide their full identity says everything about the COVID societal and health crisis and the officials in charge. One should never have to hide one's views in a democratic society and in a health system where our salient goal should be to ensure the well-being of people. I want to explain to you a bit about professional ethics to help you understand what makes the situation so dangerous for all of us. Health professionals are guided by 4 fundamental principles that are interpreted differently by diverse professions to suit their scope of practice. The 4 guiding principles are autonomy, beneficence, non-maleficence, and justice. My analysis indicates that the government-enforced policies implemented by health officials during the COVID health and societal crisis violate each of the 4 fundamental principles. History indicates that an unethical healthcare system often preempts or concurs with totalitarian and repressive societies. One might find it interesting to note that the Nazis used their healthcare system to hurt and kill people prior to instituting mass genocide. First, let's look at the steps taken during the COVID-19 societal and health crisis, and then we will look at the implication of these steps from an ethical perspective. Throughout this crisis, health officials have emphasized and continue to focus on one idea, which is reducing the spread of one virus, SARS-CoV-2, and decreasing the incidence of the associated disease, COVID-19. Officials use forecast modeling to help them find a means of reducing the spread of the virus. The forecast models predicted rates of severe illness and death that, thank goodness, never came to pass. However, the findings led to assumptions regarding social distancing and the creation of government-enforced restrictions. Supposedly, these severe measures were to last for a short period of time in order to supposedly protect the well-being of the healthcare system from being overwhelmed by severely ill people that were going to stress the system. Forecast models are still in use, despite that their predictions in most areas were inaccurate and may have caused harm at the individual level as well as a societal level. One may note official language and the salience of the term social distancing as a means of reducing the virus and incidence of COVID. The problem with the current approach is sole regard for reducing the spread of virus without adequate attention to human complexity. Humans are indeed complex beings with multiple needs, functions, health conditions, systemic interaction, and much more. An approach emphasizing one variable, the virus, and reducing the spread of COVID, without adequate regard for associated multiple determinants of health, behavior, function, development, health, and illness is not conducive to research or clinical work with human beings. Individual as well as current systemic distress attest to the apparent harm caused by insufficient regard for all associated variables. Furthermore, there is no evidence to indicate that the officials engaged in an adequate risk-benefit analysis required to ensure the safety of the government-enforced measures. In this case, one would have hoped that the officials would have completed valid and reliable risk-benefit analysis of each intervention to ensure that each measure would indeed be beneficial and more beneficial than dangerous, and to guarantee that the risk of the intervention would not outweigh the risk of the viral infection. One would have had to consider all the variables related to each intervention in order to complete this task efficiently and to assure that the measures would not cause harm. From an ethical perspective, it's important to note that in clinical practice, regardless of whether the client is an individual or the client is a community or country, one must always ensure that the interventions enhance well-being, are safe, and do not cause harm. The lack of compensatory measures available to facilitate well-being has been challenged by the interventions, as well as the absence of a transparent and tangible multi-leveled plan to restore homeostasis in the future suggests that the officials failed to adequately consider the risks of their interventions. The fact that officials continue to enforce measures without regard for the harm caused is a significant indication of their failure to weigh factors appropriately. The officials regularly stated that the virus was novel in order to excuse their actions. They state that there was no information to help them make better decisions at the beginning of the crisis. However, healthcare providers deal with new conditions, diverse presentations of existing diagnosis daily. They are required to use critical thinking and to turn to existing evidence to help them resolve issues. In this case, there was ample information in multiple domains that the officials could have used and entered into a valid and reliable risk-benefit analysis to ensure the beneficence, safety, and ensure no harm come from the government-enforced measures. Now I will review the evidence and relate it to ethical principles. The first ethical principle is autonomy. Autonomy means that we see humans as worthy beings capable of making their own decisions about health. Healthcare providers facilitate informed consent by providing accurate, reliable, valid, and truthful information to people, and by also respecting decisions that people make, even if they veer from the professional's viewpoint. Health officials should have referred to their ethical codes and ensured that they entered this most significant ethical value into their risk-benefit analysis of the interventions. Their apparent lack of regard for autonomy was the first issue that caused me to question the measures. Very early in the crisis, I began noting that the information provided to the public and also to professionals didn't make sense. In other words, I saw from early on that the valuable principle of autonomy and informed consent were being violated. People were being frightened constantly by inaccurate supposed number of deaths in apparent multiple cases without being told about the denominators, without comparing to other conditions, other health conditions, similar infections in other years, or even the provision of appropriate demographics. The physicians or the officials continue until this day to shout out the number of cases without defining what they mean by cases and without defining what they mean by the severity of symptoms, without differentiating between mild, moderate, and severe. Policies such as public masking, mask wearing are changed without any regard for evidence and actual health principles of physiology, virology, and other important information. Similarly, the information on the new apparent vaccine is provided with half-truths, exemplified by messages that the vaccine will save lives and that the health professionals must promote it to their clients in order to save lives, without acknowledging that the COVID-19 recovery rate is 99% for most people. So whose lives are they going to save? All information is accompanied by nauseating marketing slogans such as stay home, be safe, we're in this together, this is almost over, do this, and it will help the crisis end. And now they've added the new mRNA substance is the light at the end of the tunnel that will help this soon be over. Inaccurate, partial, and missing information is accompanied by fear-mongering and pressure. These non-respectful methods are still accompanied by shaming and blaming. The authorities regularly use people as scapegoats when things do not go in accordance with the officials' plans, or when people dare to state views or engage in actions from health policy. One official called people selfish and dangerous in May 2020 when they ventured to go out to get fresh air in city parks after weeks of confinement in apartments, many of which do not even have balconies. Another official recently used derogatory terms to define people during a webinar when she told the professional participants that anti-vaxxers and anti-maskers were behind the myths about the new mRNA substance. These statements and actions are out of line with the valuable principle of autonomy, informed consent, and respect for people's decisions. Health officials should have considered the evidence regarding the essentiality of respect for autonomy in an adequate risk-benefit analysis of interventions. So that's autonomy. And autonomy is evident in all of the other principles. We'll look now at beneficence. Beneficence implies that healthcare professionals take steps to enhance people's well-being in line with their individual condition and goals. So autonomy is relevant. We don't just do things for people. We find out what's important to them, and we individualize the program. This principle indicates that healthcare providers attempt to enhance the health status and do good for the client. Thus, the concept of autonomy, respect for people as individuals with the right to make their own decisions, as well as to disagree with healthcare professionals, is part and parcel of the steps that they take to increase people's health status. The risk-benefit analysis takes all factors into account to ensure that interventions increase people's health status and well-being. Now, there was evidence available to officials that could have, but wasn't, entered into an adequate risk-benefit analysis to ensure beneficence. First of all, one wonders what stopped officials from adequately inputting insights from the SARS 2003 Evaluation Committee to ensure adequate PPE, ventilation, as well as other factors highlighted in the critique in order to save people from enforced measures. I must also question to what degree health officials turned to and used existing information on virology, other corona or similar viruses, or comparable conditions causing respiratory distress, such as air pollution, to inform their actions. There is valid and reliable information on the important role of ventilation systems. to reduce the risk from virus and other pathogens. What is the reason that the officials didn't emphasize ventilation instead of other harmful interventions? In fact, I have learned from an expert that the simple installation of a window fan in classrooms might have protected children without the need for the harmful procedures that impede normal and healthy development. Consideration of these factors might have been entered in an analysis and used to create beneficent plans and enhance health. There's also no indication to suggest that health officials attempted to implement beneficent interventions in other ways, aside from their focus on apparent prevention through distancing and minimal regard for actions such as hand washing. The information on hand washing and other lifestyle information was shallow and difficult to apply. We were shown a picture of the hands going like this, like the wheels on the bus. Compare that to the way that physicians and nurses and other health care professionals are taught to wash their hands. They use the precept of apparent prevention to close businesses, distance us from one another, and these interventions were harmful, but they might have used these interventions in different ways or other interventions to make us healthier. Instead, they instructed us to cover up, hide our faces from others, stay home, stay apparently safe, but it wasn't safe for people who lived alone or in abusive situations, for example. And we also had to distance ourselves from city parks, sunshine, green areas, and gyms. Many of these actions that were supposedly and were posed as if they were doing good may have actually reduced well-being by decreasing immunity. The immune system is an innate mechanism that helps protect us from infection, illness, and also helps us heal and recuperate when we become sick. Consequently, one might have expected officials to research, review, convey information, and to create conditions to enhance immunity. The apparent contagious nature of the virus and severity of conditions, in accordance to the official view, should have encouraged health officials to research and include every possibility to enhance immune function, including complementary medicine. The argument rejecting complementary substances due to apparently limited research is weak in light of the fact that health officials enforced interventions that were not based on any up-to-date studies or adequate risk-benefit analysis. However, the absence of adequate educational programs, government messages, and conditions beyond wash your hands and hide suggests that the officials failed to adequately regard and integrate information to enhance health, well-being, and immune function. They should have created conditions enabling healthy lifestyle, and they should have conveyed tangible information enabling people to convert theory to action regarding diet, vitamins, supplements, exercise, sunlight, greenery, relaxation, and social interaction. Indeed, social interaction, and especially touching, enables the secretion of essential hormones and neurotransmitters that enable well-being and immune function. No, you cannot touch people during a Zoom session. The officials' emphasis on social distancing without adequate compensation attests to their ignorance in this area, much to our detriment. Many might remember Dr. Tam's declarations regarding sex with masks and masturbation in place of intimacy. These exemplify the ignorance in this field. There is little evidence to suggest that health officials researched and paid attention to risk factors outside of social proximity, meaning getting close to one another. Smoking, for example, smoking cessation. This area should have been attended to in order to enhance health and well-being. And all people in the families of those who are sick at home and in hospitals should have also had information and choices made available to them to advance early detection and reduction of symptoms and means of enhancing health. Effective, empathetic, skillful, and easily accessible resources should have been far more available than the existing services. It appears that the officials also failed to actualize good enough, beneficent care for people with severe cases of COVID. Reports indicate that information about and permission to use diverse and inexpensive medications that are now being used in some institutions was withheld for long periods of time. Officials should have, but didn't provide enough information and create adequate conditions, enabling all of us to enhance our health during an apparent viral outbreak. The fact is that seemingly preventative acts instated by officials and intermittent flattened curves have done little to enhance our overall well-being. The excuse that some people did not comply is weak and demonstrates the lack of accountability on the part of health officials. We are not robots in labs. We are whole and complex people. The scapegoat excuse is shot down when people take into account the normal behavior of viruses and also the fact that compared to life prior to COVID-19, people are now displaying high rates of compliance with social distancing, masking, and all of the difficult measures. And yet, despite that most people are complying for a very long period of time, here we are in a much worse state from health perspective, societal and developmental perspectives. Much worse state than we were prior to this crisis. There's very little evidence to demonstrate beneficence during this crisis. In fact, when one continues to analyze the data, it becomes apparent that the official interventions have caused more harm than good. And we'll go now to the principle of do no harm. This principle is often paired with beneficence, do good. However, in this case, one must engage in an adequate risk analysis to ensure that the outcome of all interventions, simple or complex, do not cause harm to the patient, client, person, regardless of the intent to do good. The outcome of the treatment, i.e. the government intervention, should not be worse than the result of the infection from a potential harm or pathogen. One's intention to do good does not override the actual consequences caused by an intervention. Obviously, this means that one must know all aspects of the treatment in order to complete a valid, and reliable risk-benefit analysis ensuring safety. In other words, the officials should have, and they still should and could, enter all of the variables associated with each and every intervention to ensure safety. In addition, the officials should have and can still weigh the risks of the intervention against valid and reliable statistical information regarding case symptoms distribution and recovery rates. And indeed, there was and is ample information regarding the possible side effects of lockdowns. There is information on the association between reduced income, stress, and illness that should have been entered into a risk evaluation when considering lockdown. For example, officials should have reviewed basic information that they all likely studied as medical students on the mind-body stress mechanism and the health consequences of the HPA axis, hypothalamus pituitary adrenal axis. And when this axis is in overdrive, we have pathology. And the pathology contributes to, but is not limited to, cardiovascular disease, autoimmune disease, cancer, mental health disorders, and also reduced immunity. So they are engaging in an intervention that actually reduces the immunity that one requires to fight the virus. The officials should have also taken into account the consequence of imposed lockdowns, fear-mongering on other human behaviors related to health maintenance. Accordingly, reports indicate that there appears to be an increase in illness, perhaps due to reduced early prevention, detection, and treatment due to official-induced fear of health clinics. People didn't come on time because they were afraid. And they were afraid because of the messages sent to them by health officials. And all of these conditions also contribute to stress and HPI axis overdrive. It's interesting to note that there were several theorists who suggested another way of doing lockdowns, including Ioannidis, Witowski, Bhattacharya, and others. They spoke about this from the beginning of the crisis, and then this was later reinforced by the Great Barrington Declaration. They promoted a graded style of lockdown that protected the vulnerable and enabled the healthy to sustain society. Failure to consider the kinder methodology is suggested by grotesque demands for more lockdowns and more severe restrictions on the part of the health officials. One wonders if politicians and health officials understand what they're doing to people, and if they have plans to increase services for the future disease that will likely and most unfortunately affect people in the conditions described above and who have endured persistent stress due to lost income, hopelessness, frustration, as well as the fear, shaming, blaming, and other outcomes of official fear-mongering. Most disturbing is the absolute indifference that healthcare officials demonstrate towards the hardship that some people suffer due to the lockdowns. Much like Marie Antoinette's statement, "Let them eat cake," another health official told participants in a webinar, "Don't go to stores, order online." These heartless words deny the stress and hardships of shop owners and their families who depend on this income in order to live. That statement also denies the reality that some people are unable or don't have access to computers, and others are unwilling or incapable of using online services. Ordering online sometimes is more expensive as well. And stress is an unfortunate outcome of social distancing. Officials should have given increased consideration to the consequences of lost social interaction for human development and function. The literature is abound with long-term as is increasing novel research on the necessity of social interactions and touch for well-being, cerebral and immune function. There is also immense research on the negative health effects of social distancing and loneliness that cause illness, reduce immunity, and death. Social isolation has been associated with death in the literature for years. Remember also that social isolation used to be used as punishment, was associated with racism, war, and reserved for enemies and the most disdained. Now we use this cruel tactic to supposedly prevent illness. This conceptualization concurs with less educated regulations that characterized healthcare after the 1918 epidemic and early 20th century adoration of experts and new science. So the concept, people were isolated, they couldn't see their families, they were left in hospital for long periods of time. However, hospitals and health centers gradually altered their protocols to suit increased public understanding and demands, as well as valid and reliable research. Over the past few decades, health institutions acknowledged the importance of significant relationships, social support, and touch for health and healing, and altered former restrictive visiting policies to include valuable friends and families in most procedures and admissions. Unfortunately, the lack of valid and reliable risk-benefit analysis have left many people to cope with birth, illness, and end-of-life processes on their own without valuable people by their side. Evidence linking loneliness to severe illness, decreased capacity, and death seems to indicate that severe social distancing restrictions might have very likely contributed to a high level of illness and death in some populations during this crisis. Similarly, the developmental tasks and needs of people of older age, as well as existing information on problems in long-term care, were not considered sufficiently enough, and they too should have been entered into valid and reliable risk-benefit analysis. This might have prevented some of the ongoing horror stories that many of us hear continuously. And we must also remember that the severe restrictions extend to those left mourning alone. Cultural processes and ceremonies that people use to help them with mourning were negated. Again, a Zoom, you can't touch during a Zoom. You can't hug someone who's lost their parent during a Zoom. These inhumane social distancing procedures are neither evidence-based nor ethical. I fear that we will pay a price for this cruelty for years to come. And the officials' inconsistent views on public masking exemplify another failure to implement an adequate enough risk-benefit analysis based on evidence and critical thinking. First, the data indicate that officials fail to consider the vast differences between the use of regulated masks used by trained healthcare professionals in well-ventilated operating theaters, dentist's office, and the like, where other sterile procedures protect against infection, versus the significantly different public masking, where untrained people wear, store, remove, and dispose of unregulated, as well as ill-designed masks improperly. You can't compare oranges to apples, and you also can't compare the way people wore masks after the 1918 epidemic, where people didn't have indoor plumbing in many situations, to the conditions today. You cannot compare apples to oranges. Furthermore, officials seem to have ignored the fact that there is no random controlled trial available to demonstrate the safety, do no harm, to demonstrate the safety of public masking. We may compare the lack of information about safety to a recent Danish RCT that showed that masks worn by healthy people in public provided little protection from COVID-19. So we don't know if they're safe, but we do know that perhaps they're not even needed. Furthermore, reports that some individuals or populations experience hypoxia or skin infections termed as maskne in popular culture point to the possible harm caused by public mask wearing. Appropriate definitions, valid and reliable risk-benefit analysis, inclusive of evidence regarding skin function, pathogen colonization versus infection, dead space issues, and other related topics might have helped officials ensure that their decision regarding public masking ensured no harm. Currently, officials are promoting a biological substance to the public with only minimal research behind their action. Reports from people in the field, webinars for health professionals, and lay media indicate that the officials have yet to demonstrate that they have adequately weighed the risk and benefits of this novel substance against the actual risk of the viral infection for the population in order to ensure no harm. Similar evidence suggests that the officials have also failed to acknowledge the ethical risk of withholding truthful information, as well as pressuring and enforcing the use of a substance. These actions violate autonomy and the continuation of a functional health system and democracy. Thus, evidence suggests that the officials did not engage in the required analysis in order to ensure that their interventions are safe, will not cause harm, that exceeds the damage caused by the potential pathogen, with a 99% recovery rate. Important to remember. Most significantly, harm seems more evident in certain groups versus others, and this brings us to the ethical principle of justice. The principle of justice implies that people have equal access to health care, and also implies that health measures must affect all people equally. In this case, government measures may have caused more harm to some group than others. People with safe incomes, employment, satisfying relationships, and who are able to use computers exemplify some groups who may fare better than those with contrasting conditions. So I already spoke about people of elder age living at home and nursing homes. Those are one of the groups suffering more than other groups for multiple reasons, but including but not limited to possible health and cognitive problems, which are worsened by isolation, as well as reduced use of computers, decreased income, increased social isolation. Developmental tasks and needs of older people, as well as existing information on long-term care, should have been entered and weren't, or at least not adequately enough, entered into a valid, reliable risk-benefit analysis. And children are another group who have and will suffer the injustice of measures that fully disregard their unique position as growing and developing humans. Full disregard for all domains of development in children. Official protocols for children demonstrate clearly that the officials have disregarded all evidence about child physical, so that includes the impact of masks on children, social, emotional, cognitive, and moral development, as well as trauma. I was privy to an evidence-based guide created by the Hospital for Sick Children in June 2020 that reflected, that it reflected principles of child development and acknowledged the risks of anxiety and depressive disorders in this population. The trauma, all the events that children are experiencing, being isolated from one another, disables them from internalizing and practicing skills for social interaction, for moral development, but it also contributes to anxiety and depressive disorders and trauma. And trauma that many of these children are experiencing is direct and vicarious, and it is important to work with trauma, to help people process trauma immediately, and this is not taking place. There is extreme disregard for the developmental needs in all domains. And another group who suffer increased effects of the government-enforced, non-evidence-based, and unethical measures are those requiring healthcare services, such as birthing mothers, who have to choose between one person and a doula, between their partner and the doula, and perhaps the doula could have helped them more than the partner, but the partner was more important to them from an emotional perspective. Imagine having to choose. People with acute and chronic illness, people with end-of-life issues and their families, or anyone with a hospital admission also suffer the impact of destroyed, empathetic, client-centered policies that were thrown out this past year after decades of research and practice. Thus, all four ethical principles have been violated at all levels. Failure to use evidence-based information in a valid and reliable risk-benefit analysis seems to have interfered with the health officials' capacity to ensure well-being and prevent harm. While they might have intermittently flattened the curve, they nevertheless caused harm that exceeded the good. Much like the old saying, the operation was successful, but the patient died. The more than 100 nurses, physicians, and other healthcare professionals who are attending this press conference today, as well as those supporting them from behind, clearly indicate that many and increasing health professionals disagree with the unethical and non-evidence-based government-enforced measures. Many of these people are afraid to come forward and to support the public due to enforced silencing. As I stated at the beginning, enforced silencing disrupts processes required to benefit the public, to discuss and even argue about diverse views of appropriate procedures. However, it is necessary to allow us to talk, discuss, to listen to us, to allow the public to hear the truth and to hear different views. It is now the role of the press to take these concerns into serious consideration, to fulfill their role that they have not been fulfilling appropriately. As the watchguards of democracy, as stated at the beginning, unethical healthcare is a symptom of a society in danger. You must listen carefully to those of us willing to come forward from diverse healthcare professions and to stop the harm. You, the press, the reporters, the media, must stop cooperating with the voices that silence ethical healthcare and enable nurses, physicians, physiotherapists, audiologists, and all healthcare providers to fulfill their obligations to ensure autonomy, beneficence, do no harm, and justice to each and every citizen, regardless of age or condition.
Hi, my name is Lori, and it's an honor and a privilege to be here standing with Canadian Frontline Nurses. Having been a nurse that graduated back in 1995, and my daughter is currently going through school to be a nurse, I was going through her ethics in the Fundamentals book. And I just want to leave you with a couple thoughts, something that came to mind. This is on page 16 of Fundamentals Perspectives on the Art and Science of Canadian Nursing, second edition. Nurses must agitate for change. In more than one way, nurses cannot and must not see and remain silent. People's lives are at stake when nurses do not speak up. So I encourage you all to speak up. We need to be in this together. We need to create change. Thank you all.
It is now time to rise together for the future of our children and for humanity. You can see the truth in your children's eyes. You can hear it in your loved one's voice. It shakes you to your core and you can no longer deny it. It becomes so much a part of you that you have to share it. We're uniting together and calling out more nurses and healthcare professionals to stand with us. Let us learn the lessons that history has taught us and correct the course of the future with our brave actions. It's time to have those hard conversations. It's time to challenge the narrative, to ask questions. It's time to really look at what is being censored. It's time to listen to the voices that are being silenced.
We also want to mention that we have a petition that's coming up for nurses across Canada. In the United States, they have something called the False Claims Act that protects nurses' licenses of nurses who come out and whistleblow or advocate for their patients. And so we want the same kind of protection here in Canada. And so we have a petition coming out, and we want as many nurses as possible to sign it here in Canada. And so please look out for that. And also, I want to redirect everybody to our website, www.canadianfrontlinenurses.ca.
A lot of us have been terminated and lost our jobs, and we want to continue to speak truth to the public.
Please donate.
Sarah and I want to thank you for taking the time to listen with an open mind and heart to hear all our stories and experiences that we shared with you today. If you're looking for more testimonials, you can find them on our website at www.canadianfrontlinenurses.ca, as well as www.globalfrontlinenurses.com. We look forward to sharing more with you and bringing more truth as it comes forward to us. Thank you.